Mr. Shively, thank you so much for joining us, joining me. One, it is truly an honor to represent you in the United States Congress. And for me, it's always these kinds of stories that inspire me to continue to work really hard. I can pass policies and support for our residents. And I am one of those, I need to see, did it really change people's lives? Did it help them in a positive way? And again, it is what motivates me to continue to work hard. But Mr. Shively, thank you for joining us. And, one of the things I want to hear about is, when you contacted our neighborhood service center and contacted my office, how did my office was able to help you? Can you talk a little bit about that?
Sure. I contacted you really just out of desperation. I didn't have anywhere to turn. I took a flyer and, thought I'd contact my representative. Miss McKinney has been absolutely fantastic. She has helped us through this. She has stayed on the issue. She's stayed in communication with my fiance and myself. We've had a pretty rough go the last year and a half with having diagnosed with cancer and chemotherapy, working as an RN at a nursing home, with all that, trying to get through COVID, losing her job because she couldn't work anymore because of the chemo effects. She has just been extremely helpful with trying to get us through the disability process. She's been fantastic. I couldn't be more grateful or thankful for her help, and yours as well.
Oh, no. And Mr. Shively, it is so important for people to understand, especially President Biden and so many that supported the American Rescue Plan, to truly understand the human impact. I mean, this is your life. Your life is forever changed because of the pandemic, but you're also going through a very challenging time. So everything obviously hit you and your family all at the same time. Can you talk about things that we included in the plan, like the stimulus payment, some other assistance that was helpful?
Obviously, our big issue for us is the medical bills, and losing an income. I've retaken back my second job just to help bills. So the stimulus checks and the unemployment extension, I don't know where we would be without it. I would hate to think where we are without it. It's been challenging, and like I said, our big issue is just paying medical bills. And it's been helpful. Every cent has gone to medical bills. Let's just put it that way.
And I'm trying to change that so that you should not spend your hardworking money so that you can live and provide for your fiance's medical needs as she's going through cancer. I know my father had cancer, and I have so many loved ones that experienced that. I still cannot believe how incredibly expensive it is when you become sick, especially when you already have limited access to insurance, just how little coverage you do have in the current system. But one of the things that I think President Biden to know is this is a great start in providing the stimulus payment, one check, and obviously the extension for unemployment, which I think is only until the end of the summer. Yeah. What are some of the things that you want him to know? I know for me, he knows. My folks need to feel like we're going to have their back, that the people will always come first in regards to funding and support and direct aid, direct support, versus some of the things that they do around aid to corporations and others that really doesn't touch our lives or help us at this moment. If you were to have President Biden right here in front of you, what are some of the things that you would like him to know, so that the next relief package, the next, even with the American Jobs Plan, what do you think is critically important right now?
For me, in our perspective, it's the medical coverage. Even with the government assistance that we've since had. Recently, she still has her chemo port in her shoulder, and her oncologist would like to do an MRI and a CT scan. just to make sure all the cancer's gone, we can get the port out and we can move on. And it was denied by the insurance company. How you deny someone that with trying to recover from cancer is still beyond me. So it's just that sort of health coverage or just ability to get is my big concern. That just, it blew my mind that happened. Fortunately, the oncologist scheduled an ultrasound for her stomach and her groin, just be able to try and see if she was cancer free. It just, again, still blows my mind that could happen. That sort of necessity was denied. And I think it was something like 8-10 grand out of pocket if we were to do it, and that's not going to happen right now. So that's my big thing is the health coverage and just basics, like you have cancer,
Yeah.
get a CT scan, make sure you're good, and then have it denied. It just adds a little more worry, pressure, concern. It can be frustrating.
No, it's, I mean, if anything, government is supposed to be about people, right? It's not a separate entity. It is made up of us. And this is our resources, our taxes, our, hard work that we continue to contribute in all different levels. It should result in, when I'm sick, you're the government, who's supposed to be about people, is supposed to have your back and push back against corporate greed, which is really integral part of why our healthcare system is so broken.
Yeah, it's not like she has the flu or anything, or she bumped her knee or something. I mean, this is pretty serious medical issue. I don't know how much more serious it can get than cancer.
Yeah, it's the ability to live.
Yeah,
It's medically necessary for her to figure out whether or not she's still sick and how her doctors can help her more. Absolutely. I know I'm working on a number of efforts in regards to that. People just need to understand that it won't always be perfect, but one thing is very clear: the system is not working for some of my most challenged communities, in my challenged families going through these challenges. They increasingly tell me the biggest hurdle in issues continue to be medical debt, and it's one of the number one reasons that we see high rates of bankruptcy in our country, and it impacts people's credit report, access to them be able to thrive even after they get healthy. They still live with the legacy cost of getting sick, and so we're working really hard. I don't want medically necessary debt to show up on people's consumer reports or credit reports as if it's a car you bought. No, this was necessary to live.
Yeah, I'm not making payments on a new car here.
I know. We treat it the same way as if it's like, I went and bought a bunch of stuff that I couldn't afford and some more. No, this was the ability to live. Well, I thank you so much. Any last things that you would like President Biden to know? And again, we're putting this together as, American Rescue Plan helped me. This is great. But these are all the other issues that we hope that he addresses in his term.
Yeah, I mean, it's a real good start. Regardless of politics or how you feel or how you identify yourself, I just always think that, and it's always my personal belief, is that good people help people if you have the ability. That's regardless of what side of the aisle you're on. We all want to help people, and like I said, I can't thank you enough, and Miss McKinney enough. She has been wonderful, and
I'm so glad.
If my company could have someone like her on staff, it would be great.
You're not hiring her, Mr. Shively. I was like, no.
I don't blame you. I wouldn't want to give her up either. I mean, she's been fantastic.
I actually have more staff in the district specifically for this work because I think this is what changes people's lives immediately. I can continue to pass policy and that will change lives, but sometimes it can take years before it really makes the impact that it was intended to. Sure. But boy, us picking up the phone, calling insurance companies, using the power of the letterhead, all
Thank
of that has made a huge difference in people's lives. So I'm just so grateful that my team believes in this approach. You know, I told them getting people through everyday challenges and issues is equally important to policy work. So as we pass things like the American Rescue Plan, we know that's a good start. We know that there's structural issues that need to be addressed that will never free us from the pain of watching our loved ones get sick and feeling like you are completely helpless, that you can't afford to make sure she gets the best care possible. And she didn't deserve that. She was working hard, doing her part, and she fell ill. But thank you so much, Mr. Shively. I will continue to work on those structural changes, but I also really appreciate your trust in us to serve you and represent you and fight for you. And like I tell everyone, there are so many people that continue to have challenges with me. I said, but I'm still your Congress member, like put me to work. So
Yeah,
thank you
yeah.
for,
Well, thanks for
thank you.
being there for us.
Yeah.
Again, I just took a flyer and sent an email, and here I am talking to you on camera.
Yeah.
Who
Yeah.
knew? And the help has been fantastic. We got a call back from the disability office, and things are at least finally starting to move. And I couldn't have done it. Like, we call, we get put on hold for hours. We
Yeah.
check the website. It still says pending.
Oh yeah, Mr. Shively, use this office. I tell
Oh,
people this is your office. And we did this, one woman, her son is diabetic,
mhm.
and one of the big threes kind of changed their policy in insulin, saying it's not preventive medicine, which I'm like, it prevents death.
Yeah.
And so, yes, and so we use the power of the letterhead. Before she was paying a few $100s, which was still a lot for her, and she's retired, and trying to take care of her son.
Mm-hmm.
And we sent that letter to the company, explaining to them how wrong it was, because she was paying about 1,800, something crazy like that, a month. That's how much it jumped.
Yeah.
By like 3 months later, she went in and she paid like less than $300 for insulin, which still irks me, because I'm like, it should not cost, especially because most of the insulin out there on the so-called market or availability, we, the public, we subsidize for it. We paid for the development of that insulin. And
Sure.
now they're turning around and charging my residents thousands of dollars for it. So the whole thing, it's sad and disgusting. And so I want to thank you. I know how difficult it must be,
Mm.
and how fearful it is. I watched my father deteriorate even after
I'm so
chemo.
sorry.
Yeah, no, it's okay. He didn't get to see me become a congressman. He's the one who got me into politics. He was a big UAW guy. And I remember I didn't know who I was supporting as long as long as they were Democrat. That was my dad. But he came from that old school working class in Detroit. And so he was a big on politics. I remember he only had fourth grade education, but he'd read a newspaper from front to back. That's how he learned and got really active. But it was hard, even with his insurance from Ford Motor Company. We still had to pay so much out of pocket, especially for the medications,
Mhm.
and just fighting with the insurance companies. It was incredibly hard. And then even after that, just know, you and your fiance, if you ever need any support, not only obviously with the day-to-day and making sure you all have access to the healthcare you need, but also making sure that even if there's emotional support and you're looking for a group to talk to or anything like that, know it might sometimes be helpful, just to deal with some of the pain, because it's hard to heal. You're going to be healing physically, right? She is, but also mentally,
Thank you.
how scary it is to be that close to death. So,
Yeah, she's going through, she's class A personality, she's an RN, and the after effects of the chemo is, pretty much taking her legs away, the neuropathy. It's just, it's tough on her mentally and physically, and no one wants to sit around, no one wants to, well, I guess I got to be on disability because I, might never work again.
mhm.
That's not what we want, and it's been difficult.
Yeah, I'm so sorry, Mr. Shively, but we're here for you. So thank you so much for this time.